For years and years and years, Australia has not really had any trials for patients to get involved in, trials targeting slowing the progression of the disease. So we're at a pretty good point where we have some treatments that help with symptoms, but nothing that stops the disease progressing, and that means that people end up going to nursing homes with dementia, falls, hallucinations. So really it's our first ray of hope where people can get involved with actual proper trials, instead of coming into the clinic and me and saying, oh look, I just read about beetroot therapy, shall I try that, shall I try this? And you go, no, this is actually something that's going to be controlled.
What trials are out there then?
So look, I think we're seeing two types of trials, one being, if you like, new molecules, things that people are trying to say, well look, this is how the disease works, maybe we can stop it working by doing this. And the other, if you like, is rebranding or repurposing existing drugs, and that offers, if you like, a little bit of a faster route, because if you were to take something that may act that's already being used for another indication and then use it in Parkinson's successfully, that means we'll get it much quicker to get into the clinic.
Quicker to get into the clinic. That's what people want to know.
Of course.
How long is it going to take?
So look, the trials are running now, so people can go to the Australia New Zealand Clinical Trials Registry, anzctr.org.au, and go and search what's going on in Parkinson's here in Australia and Sydney, wherever, and find out what trials are available. And so there are people who are starting these medications now, and the hope is that if, for example, a drug that was already at market was to show an effect, then probably it would be whistled through within a couple of years. So an average trial will probably take 3 years, add another year or so on for the registration. This is actually, I think, some real hope as opposed to hype.
That's Australia. What else is happening elsewhere in the world?
Yeah, so we're seeing, I think, as I say, in the, if you like, North American space, more in that sort of novel molecules, people using infusion therapies, trying to bust up the abnormal proteins that are dying inside the dying cells. And then around the world, we're also seeing this initiative, this linked clinical trials initiative, where people are saying, look, we have a major problem. Can we all work together, get sites doing multiple trials to if you like, get through and see what we can evaluate as potential new treatments?
What is the state of treatment at the moment? Because it just seems a bit ad hoc.
So I think what happens when we look at patients is we actually say, well, it's Parkinson's disease, but they all look very different. Some people come in, they have lots of tremor, some people have no tremor at all. And you say, well, do we treat those guys the same way? And the answer is maybe. And then you add in things like mood disturbance, sleep disturbance, problems with, psychosis, hallucinations, dementia. So it's a moving target, and we have to be very, very, if you like, good at recognizing what our patients need.